Here you go. Welcome. I'm Teresa Schmidt of Exercise Resources Incorporated, a physical therapist, board certified in orthopedic physical therapy, and I'm delighted to share with you some fabulous tools that you could use for doing some of your own therapy at home. And also for clinicians, these are fabulous tools that will save your hands and give your patients some excellent positioning for your therapeutic interventions, as well as some great stretch and relief of trigger points, pain, tension, to improve that functional mobility. These are Renewdles. One of my students introduced me to these, and she created them as patented devices. There's a 6-inch size, and they're a very nice compressible foam that maintains its shape. There's a 4-inch size, and of course then we have a shorter, just under 2-inch size. I like to start for stretching on the patients using the smaller Renewdle, gradually working up to the medium, and then of course finally to the large, particularly for athletes who need a little more stretch. More of your average everyday people, the medium, and the small one for more of your fragile geriatric patients or for people just starting out. So we have Edward is here, and he's going to demonstrate with us some of the use of Renewdle. Notice that you have a shape here so that you can actually line up the spine. In this depression here, there's a nice opening for the spine, and you have these massaging rollers to work on the erector spinal muscles, and then soft, flat areas around the ribs, hugging the body. These conformations in the Renewdle are great for body positioning of arms, legs, just about anything. So let's try first, if you had some neck tension or headache, forehead posture, we like to just pick up your head. Let's get that right smack in the middle. And get it underneath those bumps at the back of your head. And it's a wonderful suboccipital release. So if we just zoom in here, you can see you want the Renewdle bumps just underneath the base of the skull. You feel how that just puts a little pressure there? Mm-hmm. And allow the patient to spend a couple minutes just resting on the Renewdle. As the myofascial tissues give way and relax, the head will tend to just sink down. So let your head be heavy and sink down. Focus on breathing into your belly. Relax your eyes, relax your jaw. Let your shoulders and hands drop down if you like. And just gets a wonderful relief for the suboccipital areas, some of the attachments of upper traps at the occiput, and releases that tension that people are walking around with. I typically tell someone spend about 2 minutes in a spot waiting for the release. I think if they spend too long with pressure in one area, it tends to be a little irritating to the tissue. So once that relaxes, you can gradually move this little Renewdle down and work on another segment. So you can work intersegmentally down the spine. You can also discover what happens if you tilt your head a little bit, tuck your chin, and back, look up, look down. Feel how you can massage the back of your neck by a little nodding, very gently. And see what it feels like if you have a little tilt side to side. As he tilts the weight of his head side to side, the massaging rollers are going to start working into the erector spinal muscles. So he's just tilting, letting these areas dig in there like fingers, using the effect of gravity. So very simple, breathing throughout and moving slowly, comfortably. If you find a spot, feels like a sweet spot, you want to get in there, let it stretch in that spot. Nice and easy. How's it feeling so far? Good. We got the thumbs up. Now if you're feeling that this is very gentle and you want a little bit more vigorous stretch, we're going to switch to a larger foam roller. And this is the medium one. And you can just place that underneath. Find the area. Everybody has a different zone that they need a stretch. Work with your physical therapist, chiropractor, athletic trainer, whatever you're working with, personal trainers. Have them guide you in how to use the equipment. Don't just try it for yourself. How do you like that? Yeah, another thumbs up there. Give it a shot and roll around on it. Now a precaution when working on the cervical spine, if he's stretching in his neck, for people, particularly elderly folks or people who've had head or neck injuries, of course, you want to clear this movement and exercise with your physician first, or your healthcare practitioner, your therapist, trainer. Some people get dizzy when they tilt their head back, And if you're one of those people, do not tilt your head back on the noodle. Stick to the shorter one and keep your neck either a little forward or level, but never tilting back. And if you have any dizziness when you move your head or tilt your head, of course, see your physician to find out what that's about. Dizziness can come from problems in the nervous system, brain problems, inner ear problems, and that should be diagnosed by a qualified physician. Like that one? Little extra stretch?
Mm-hmm.
How about we start to move it down the spine, and as we go down the spine, you could work on your entire set of vertebrae from the top to the bottom.
Okay.
So come on up, put it down a little bit lower, make sure the space is in the middle for the vertebrae, and let your shoulders sink back, head sink back. This is also a nice chance where if you wanted to use two noodles at the same time, if you wanted to avoid that excessive hyperextension, you could support the head with the smaller noodle or another 4-inch noodle. So you're getting like double jeopardy here. And just let your body sink back, let your shoulders drop back, let your arms drop down, open up, and it opens up the chest. Let your shoulders drop back. This can easily be done on the floor. We just happen to be using a therapy table for the purpose of the demonstration, but a nice cushioned mat on the floor is wonderful. How do you like it with the double rollers?
Great.
Your extra set of hands, right?
Mm-hmm.
Breathe in and let everything expand. Let your shoulders drop. So you get a nice stretch through the pecs for that slumping posture that people often have. I also recommend when you're first trying this, keep the hips and knees bent like this. We call that a hook lying position. And it takes some of the stress off the low back. Especially if you're not used to doing this kind of stretching, it might feel a little rigorous. Let the low back be relaxed while you're working on the upper back until you get used to doing more and more degrees of stretching. And of course, check with your medical practitioner if anything is uncomfortable to you. Okay, so let's see if we can move that down the back a little bit more. So bring your arms in, move it down. You can keep this one for your head if you like, or just let it drop back. And now we're getting quite a bit of extension in the thoracic spine, so let your shoulders open, dropping back. How is that one for you? Now breathing into the stretch. Breathing into the stretch. See what it's like if you bring your hands together and begin reaching overhead. Forward in front of your body, clasp your hands together, and very gradually up overhead. Now you start to get some stretching down through the chest, the shoulders, into the back. You feel how that increases the pressure on the noodle underneath you?
Mm-hmm.
You can get into those muscles a bit. And slowly and gradually breathing in and out, arms coming down. And you can do a few reps of each of these with the arms coming up overhead. Breathing in deeply so you feel your ribs expanding. And note the extension that he's getting here. How is that for you?
Okay.
Nice and easy. Come on back down. Bear in mind for some people who don't like to have their head back, or if they're dizzy, it may be a pillow underneath. You can still get some nice extension in the back, but a little more comfort for people, especially if that's too much of a stretch. Put a little head pillow, get some excellent support. And breathe big when your arms are up. In. Beautiful. Let everything expand in the ribs. Feel your lats stretching, tricep stretching. Beautiful. And come on back down. So you can really take your time working at individual segments of your spine, wherever you have some tension. And then you can add a little bit of rotation as well. So if you bring your arms straight in front of your chest, hands together, see what it's like to just rock a little bit on the Renewdle and start massaging into some of those muscles. So a small rocking motion first, really slowly. A nice, easy rocking motion. Beautiful. And breathe. So always start with a small range of motion first. Make your arm sweeps left to right bigger as your body is loosening up. It should feel good. If something hurts, take it out. Have that checked out. You should feel like a good stretch. Some people get a little stretching discomfort. Think of it of a pain scale, 0 to 10. If 10 was the worst pain you could imagine, and 5 is the midline, 0 is no pain, you want to keep that well below a 5. Just a stretching, good working out sensation. Sometimes you might hear some noises coming out of your spine. Occasionally there's a little crack or adjustment. It's not a broken bone, that's just a shifting of the joint inside, making noise. Little creaks and cracks, it's okay. We call that mobilization. Everything should be gentle and never forced. How is that for you?
Good.
And relax, and we'll come down another layer. So this time, get up yourself, reposition the noodle yourself, see how you do without me helping you. Just grab it, glide it down your back yourself. Find another spot you want a good stretch. See that you have it in the center. Good. And come straight up. So it's a great warm-up. This in particular helps to increase extension or backward bending of the body. So many of us spend hours in a slumped position, slumping over our cell phones, slumping over our dinner plates, slumping over our school books and our computers. So this gets you open instead of being in that forward head slumped posture. Many of us don't spend enough time stretching and exercising, so we say, oh, I can't reach my arm overhead, it's so stiff. This is a great way to start loosening up the shoulders as well. Try the rocking this time. We're moving a little faster just because it's a video demo, but spend a few minutes on each of the activities, whatever you feel gives you the best stretch. Feel how that's quite different?
Mm-hmm.
Can you feel a difference from side to side, or the two sides feel the same?
Right side slightly different.
So very often patients have some imbalances where one side of the body is a little tighter than the other. So bear in mind that that is a typical thing. You might want to focus more on the tight side, spend a little more time there. Breathe into it so you get that nice trunk rotation, and come on back down. So sit up for a moment. To sit up, now young athletic persons such as Edward, no problem coming straight up, but for those of us who are in the aging process, it's best to roll a little bit to the side before coming up. So try it down in the low back now. Position it so you feel it at the center. You can actually lift up your bottom to position it, like we call that bridge, lifting up, positioning. And now see what it feels like if you let your legs down, because now we're working in the lower part of the spine. You want to see if you can get that normal lordosis or arch in the back, and just let everything relax back. How's that feeling for you?
Good.
One of the common things that happens is people get tight hip flexors, the muscles in the front of the hips. These are muscles that lift up your leg when you go to climb a stair. We sit too much, way too much sitting, way too much forward bending. So we want to start stretching the hip flexors. So I'd start with stretching the low back over the Renewdle, and then gradually as you move the Renewdle down, when you get to where those bumps are in front of your hips, you get the Renewdle down a little lower, you're going to start stretching the front of the hip. So we'll be doing that next. To lift up from the noodle in this position, bend your knees, put your feet on the mat, and you can just slip your hand in to grab the Renewdle, lift up your bottom and your back, slip the noodle down lower. Good. Always keeping that relief in the middle, and then drop onto it slowly. Let go one leg and then the other. And now you're going to get a lot more stretch across the pelvis and the hips. So stretching those hip flexors, feel the pulling coming in here. This should not hurt the low back at all. Some people who have some instability in the low back, herniated discs, for example, might not tolerate this motion, or people who have very tight muscles in the front of the hips, the hip flexors, that might be a bit much for them. So I would go back to starting with the small noodle again, gradually working up to the middle-sized, and for our athletes and more rigorous stretchers, gradually working up to the giant dig deep noodle. Okay, feel good there?
Mm-hmm.
When you come out of this, bend your knees first. That avoids stress to the back. And then you can just pull the Renewdle out, lift up your bottom, pull it out, and remove it. Great. So that's a wonderful way to get some spinal stretch using the Renewdle. How does it feel for you?
Great.
Ready for a nap?
Possibly.
Or a workout?
Nap would be good.
So try it for yourself. These are guaranteed by the company, Renewdle, and it's a wonderful, wonderful tool. We're going to look shortly in how to use it on different body parts, so stay tuned.